Well, a promising new high-tech medical device could help some people move away from prescription painkillers. The FDA recently gave it the go-ahead. 26% of Americans who are 20 and older report some type of chronic pain. Every day, more than 650,000 prescriptions for opioids are filled. But 2 million Americans are addicted to those painkillers, which often provide a gateway to illicit drugs like heroin. Our Dr. Tara Narula is here with how a drug-free approach lets patients stop the pain. I love this woman you interviewed. She's so strong-willed.
She is, absolutely. Good morning to you. Chronic pain can affect every aspect of patients' lives, preventing them from working, caring for family members, or even themselves. It often starts in the back or leg, but it can quickly become all-encompassing. Doctors now have a new tool to help decrease the perception of pain, a small implant placed in the back that can get patients back on their feet. Connie Hanafi had a passion for riding dirt bikes.
Go ahead, kick it to JoJo.
Then minor leg surgery sidelined her with crippling pain.
I love your picture.
Steroid shots, seizure medications, nerve blocks, and physical therapy did not bring relief.
Oh, perfect.
Because of her own family history of addiction, Connie refused prescription painkillers. The pain was so unbearable, the single mother of two considered amputating her leg.
The pain is constant. It's stabbing, it's burning, it's shooting, it's every type of pain you could ever imagine all in one. And you're trying your best, but you're just screaming on the inside because nobody can understand what you're going through.
Then Connie learned about another option.
Good morning.
A spinal stimulator that zaps pain. She decided on surgery to implant the device in her back.
Lots of pressure again. Try not to jump.
Connie, tell me when you feel this.
During the first part of surgery, she is sedated but awake,
Yeah, I can feel that in the bottom of my foot.
giving real-time feedback so the stimulator wires can be placed in the right spot on her spine.
Okay, is it going into your foot, into your toes?
Not my toes, no.
May I turn it up?
Yeah. There you go.
And we have everything?
Yep, oh, that's perfect.
Spinal nerve stimulators use electrical pulses to block the pain signal to the brain. They've been used for decades, but previous models were bulky and needed frequent charging. This summer, the FDA approved the smallest implantable device, about the size of a pacemaker.
Let me know as soon as you start to feel it.
In the recovery room, Connie feels a tingling in her leg.
I can feel it. Oh, I can feel it. Oh, thank God.
Confirming the device is working to mask the sensation of pain.
The majority of patients will report at least 50% reduction in pain.
Yusuf Josephson is one of the first doctors trained to treat patients with Medtronic's new implant.
And this device has a tracking component so you can monitor what activity they're doing. How is that helpful to you?
What it allows us to do is real-time follow that patient over a period of time in terms of their functionality. Because ultimately, if they're still sitting on the couch, that's not what we want as doctors. We want them to be functional and enjoying their lives.
This is really what I want to get back to.
So the goal is to get back on this?
Yes.
One day soon?
Yes, this is my baby.
2 weeks after surgery, Connie's pain has dropped from level 9 to 2.
Like really want to get active. I think, I know I got to slow down a little bit, but I feel great.
She has a long road ahead before she's riding dirt bikes again. But she's kept her leg and has her life back.
So is there something that you want other people who might be suffering with pain to know from your story?
Prescription medication, although it does help people, that's not the only answer. And if that's not something you want to do, seek out other options.
This implant does carry risks like bleeding and infection, and spinal cord stimulators are not appropriate for every kind of pain. They're best for people with back and limb pain who may have failed back or disc surgery and other conditions. About 88,000 have been implanted worldwide. That's expected to more than double in the next decade.
And you have the prop here with you. It really is so small.
It's very small. I mean, this is the device that gets implanted in the back, and these are the wires that get implanted in the spine. And this is the device that the patient can use to control the stimulation. Wow. So very small.
So to go from a level 9 to 2, that's a game changer. Is this a permanent fix?
It can be. The battery, this part, needs to be changed about every 9 years, but essentially it's otherwise permanent. And
How much does it cost?
Right, so it's about $30,000 for the device. That doesn't include the price of the actual procedure, but it is usually covered by insurance. So, good news, something that people need to be aware of to ask their doctor about.
And it's certainly worth the cost if the only other option was amputation.
That's right,
Glad
or
they found
narcotics or
something.
opioids.
Or narcotics.
Stay off that dirt bike, though.
Yeah, thank you.
She loves that.
Yeah, thank you, Dr. Tara.